Hello, everybody, and welcome back to the second episode of Off Label Careers, the podcast where we explore different paths into big pharma. Joining us today, we have another very special guest.
Hi everyone, my name is Charlie. I am a change management intern at a big pharma company right now, and I'm also in my last semester of undergrad studying life science at U of T.
Amazing. Charlie, thank you so much for joining us today. And, from our discussions before, you had quite the history. I believe you've worked at other pharma companies before as well, right?
Yeah, so I worked at another big pharma in clinical operations for a summer internship, which was 4 months. And then right after that, I talked to a lot of people during that internship, coffee chatted a lot from different departments, and then I found out about something called market access, grew really interested in it, and I was like, okay, during that time, I noticed another internship got posted on LinkedIn in market access, and I was like, why not just apply? I did see it within the first hour, and I think that really helped me get an interview, even though it was meant for master's students. I was like, why not just apply? What's the worst that can come out of it? And I ended up getting an interview, and I ended up working there for the last 16 months, and it was a great experience.
Wow. So, to get this straight, you worked in clinical operations at one company,
Mm-hmm.
then did global market access at another company, and are now working back at this company in change management.
Mm-hmm. Yeah.
Wow. And this was all in undergrad.
Yes, so I actually had to take an extra semester because I had to delay my graduation for the 16, well, it was a 12-month internship period for the global market access role, but I really enjoyed my time there, so my manager wanted to extend it for another year. So that whole stint was like 16 months while simultaneously finishing up undergrad. So I guess technically I'm in my fifth year, but because this semester I don't have any classes, I was like, why not get another internship in a different department, which is why I'm in digital technology right now.
Okay, you're like a seasoned veteran already, eh?
I wouldn't say that.
So let's take a step back. Was this
Mhm.
something you always wanted to do, like high school, first year undergrad onwards?
No. Okay, I had, like a lot of life science students, I also went into U of T life science thinking that I was going to go to med school. In high school, all I wanted to do was be a doctor. My ideal dream in the beginning was to work for Doctors Without Borders eventually, but obviously after going to university, doing all the life science courses, I realized that it might not be the best path for me. Obviously, I want to work towards something that helps patients ultimately, but I realized there's other career paths that I could explore that also leads to that same outcome, which you're helping patients. I did a couple of volunteer positions and internships at clinics and hospitals. However, I didn't really like the experience as much, and that's when I started networking a lot. And that's how I ended up networking with someone that worked in that first company that I worked at. And I applied to the summer internships with their referral and I ended up getting the interviews, and that kind of started off my career path in pharma industry.
So this was in first year, second year?
No, so I started looking into like what career paths I could explore actually really late. It was in third year.
Hmm.
So before that, I was doing a lot of like work study positions, doing a lot of volunteering, clinical internships, so summer internships at clinics, hospitals. And I realized this is not something I'm enjoying. And then quickly after, during third year, that's when I started actually looking into different career paths and trying to network a lot and trying to network with a lot with people who had the life science background, but they weren't traditionally in like a hospital care job.
Right. Two questions. Are there any specific moments when you're in that healthcare
Mm-hmm.
field that triggered you to look into another path?
I think for me, I really wanted something that would give me work life balance.
Mm.
And I realized if you're a doctor or working in the healthcare setting as a HCP, whether it's a nurse or even a dentist, or like work life balance is not something you could ideally prioritize, especially early on in your career. And for me, I wanted to kind of prioritize that when thinking about long term career paths. Um, so that's kind of what started it. And I realized I'm also not as strong as I thought I was. Meaning, if I see a patient that literally had their legs cut off, like I feel like I would freak out and have a panic attack. And that's not something you want to have as a doctor. So I felt like maybe I should explore different career paths. And I ended up joining a couple of mentorship programs. And through that, that's how I found my mentor that worked in pharma.
Tell me more about the mentorship programs.
Yeah, of course. So I was to kind of give you a background. I did a specialty. My sorry, this you have to cut out. But I did a global health specialist and a nutritional science major. So from our major, we always do a like a mentorship program for people in nutritional science. So I joined that for the first mentorship program. I got paired up with a professor from Laval University, and I talked to her about a lot of like her advice, what she would tell her younger self, a lot of like research stuff. And I realized like I don't really see myself working in a lab setting, I guess 24/7 or for my entire life. And I was like, and then she was the one who's like, oh, why don't you like start coffee chatting and networking with people in different industries? So I joined another mentorship program through another club at U of T called U of T Women's.
U of T Women's.
Yeah, and I wish I knew about it like in first year or second year because they had some amazing people part of this as mentors. And I got paired up with my mentor who was in a healthcare background. So she was working in the public health realm, and then she transitioned into pharma as a health systems partner. And in the beginning, I didn't know much about the pharma industry. When I saw her role, I'm like, I don't really know what this means. I didn't even know about the company because I really wasn't interested in pharma like that. But when I searched it up, I was like, wait, this is a really big company. And this is like a huge opportunity to be able to talk to someone in such a role at such a big company. So I obviously had so many coffee chats, but I would have coffee chats with her every 2 weeks, like make it like a reoccurring thing. And I was like learning so much from her.
This
And
was with the mentor.
yeah, this was with
Okay.
the mentor. And honestly, she gave me a lot of advice. Like I feel like luck played a huge role as well because if I didn't join this mentorship program, I wouldn't have met her.
Okay. What was the mentorship program called again?
It's called U of T Women's Mentorship Program.
And the other one you said you joined as well?
It's a nutritional science mentorship program, but that one is specifically for nutritional science
I
students.
see. Okay.
Yeah.
Now, when it comes to networking, so you learned from the mentorship and
hmm
then you started networking with other people in the industry as well?
Yeah. So during my first few coffee chats with her, um, I was telling her how I was kind of in a position where I was very lost about what career path to choose. And I was also exploring master's programs since I was in third year. I have to really start thinking about it, since I was going to go into fourth year. And then she told me about a program called M Biotech, which you're
Oh,
very familiar with.
yeah.
And then she connected me with people in the company because a lot of M Biotech master students end up going into the pharma pathway. So she connected me with a few people, actually someone in market access, the first person she referred me to. And I learned about M Biotech program. I did a lot of research. I found out that my cousin actually did the M Biotech program as well.
Wow.
So I copy chatted her. And then she referred me to a couple of people. So that's kind of where it led. Like I felt like at the end of coffee chats, you should always ask the question, "Oh, is there anyone else that you recommend me connecting with?"
I see. Okay.
Because then they can refer you. If they think the coffee chat went well, they would be more than willing to refer you to other people that they think would be a good resource to you.
And it leads to kind of a chain reaction that
Yeah,
grows
yeah,
your
yeah.
network. Okay,
But
beautiful.
one thing I will highlight is also really important to keep on recurring coffee chats. Don't just do one coffee chat and then let it be like the only time you talk to that person because keeping that relationship and making sure that you're kind of keeping like I guess having follow-up coffee chats. It doesn't have to be every month, but every few months, kind of like doing check-ins is always good so that people remember you.
Interesting. And how did that era,
hmm
networking, getting your foot in the industry,
hmm
how did it lead to getting your first role in pharma?
Yeah, of course. So I think for me, what really helped is that me always scheduling these coffee chats with my first initial mentor, and like doing recurring coffee chats with her almost every month. Um, Before she even gave me a referral, before she even told me about this internship program, I've already had like over 10 coffee chats with her. So she had a good understanding of who I was as a person. She had a good understanding of what I was doing, for example, leadership activities and all these other extracurriculars that I was part of. And she thought that I would be a great fit for the summer internship program because she could really see me thriving in like those positions. And she told me to just apply. I ended up applying to like more than 12. She graciously referred me to all 12 of them. I did a couple of interviews for those summer internship programs. I also actually for the first company, the first role I got offered was a 12-month internship, not the summer internship.
The
And that,
clinical operations one.
yeah, so it wasn't in clinical operations. It was in pharmaceutical. And
Mm.
it was a 12-month internship that I applied without her referral. I just applied because I was like, I thought that was the summer internship program that she was telling me about. So I was like, oh, I saw this and I applied right away, got an interview. They actually asked me to come in person. And I think coming in person really helped me because it left like a good impression on them. It was like an hour-long interview. They asked me a lot of questions. I treated it almost like conversation, and obviously I came prepared with also questions to ask them, and that helped me. And that was like the first, I guess, position I got offered. But because I was still waiting for the summer internship results, I held off because I didn't know if I wanted to delay my graduation at that time. So I ended up going with the clinical operations 4-month internship.
You mentioned how you talked with your mentor often about your leadership
Yeah,
activities,
yeah,
other
yeah.
extracurriculars.
Yeah.
Are there any in particular that you think made you an asset to join this company?
Yeah, I think when you first do your, like, I guess when you're interviewing for your first ever internship, industry specifically, because I had prior internships in like clinics and hospitals, you really want to like highlight your leadership experiences because before that, you don't really have that industry experience. So, for me, I highlighted a lot of my involvement with school clubs because at that time I was like the president of Nutritional Science Student Association. So I was leading a lot of events for students in our department. I was working a lot with stakeholders, professors, students. That helped a lot because in industry you're working with different types of stakeholders. So kind of talking about your transferable skills is what they look for, and making sure that you're answering your questions in a star format.
Star format?
Yeah. So giving when they're asking a question, bring up the situation, um, task, and then action and then results. And also what I like to add at the end is like what you learn from it and also how it ties to the job specifically.
So another R, reflection.
Basically, yeah, and that really helped me with my interview because like the interviews for these internships are usually short, 30 minutes. You only have 30 minutes to leave an impression.
Yeah.
So making sure you come prepared with your answers, having a story for each question is really, really important. And also coming prepared with questions to ask them is really crucial.
If you don't mind, what type of questions did you ask them?
For me, I don't know if this is the correct approach, but I almost treated these interviews as coffee chats. So because this was going to be my first ever internship in pharma, one of the questions I would always ask, like, what is one piece of advice that you would give to an undergrad student that is hoping to pursue a long-term career in pharmaceutical industry? And then that opened up the door for they would think back to their younger self and they would kind of like give advice. And that would also one question I would ask is like, what is one what are some situations that really differentiates a intern that is good at their job versus someone that excels at their job. So then they, list out, I guess, past interns what they've done to make them an exceptional intern and like, you know, kind of like based on those conversations you ask follow-up questions and stuff.
Interesting. And luckily you had a lot of coffee chat experience beforehand
Yeah,
already,
so
so it
I
worked out.
treated it
Okay.
like a coffee chat because in my head I'm like, even if I don't get this position, at least I made a connection with someone in the industry. Because if you leave a good impression, even if you don't end up getting the job, you can like a lot of people of these like people who interviewed are still open for you to connect them on LinkedIn and schedule further coffee chats.
Speaking of LinkedIn, a lot of people sometimes, especially younger students that just start off undergrad, they get
Yeah.
very nervous when
Mhm.
it comes to reaching out to those who are much older, who
Mhm.
have a lot more experience. They might feel a little bit intimidated
Yeah.
asking for a coffee chat, right? Did you feel any of that? If so, how did you counter it? And what advice would you give in that scenario?
Yeah, I've felt it a lot. Like, I wish I wasn't this intimidated when I first started reaching out to people because at the end of the day, they're people, they're humans just like us. They've been in our shoes before. And most times people love talking about themselves and also their career trajectory. So, if you I feel like for LinkedIn, obviously like just reach them out, let them know you're reach out to them, let them know that you are an undergrad student, really highlight that you're a student because people often in the industry love to mentor students. So use that to your advantage. Highlight that you're an undergrad student, why you want to coffee chat them. That's very important. And ask them for their availability. If they don't reply, follow up. Don't be scared to follow up because most of these people are really busy. Your email will probably get lost in their inbox.
The email, or you sent them on LinkedIn?
LinkedIn or email. There's a lot of websites where it shows you like the emails on LinkedIn.
I see. Okay.
So
Well,
use that to your advantage. There's like many websites like that. A lot of times also for company emails, usually it's their first name dot last name at whatever company, you know. But LinkedIn, like cold message, keep it short, but keep it like emphasize why you are reaching out to them.
yeah. All right. And when you going back to you starting the internship,
Mm-hmm.
the first one,
Yeah.
that was at this company, I believe,
Yes.
and it was in clinical operations
Mm-hmm.
just for the summer. How did it feel entering the pharma workforce for the first time?
For me, I was so intimidated. I remember on the first day, I couldn't even talk to like the people like around me, like in the first like few hours, because I was so terrified. I was like, oh my God, I really have to like do a good job. Like, all these other people probably have experience, but like everyone around me was like in the same situation where this was literally their first internship, especially specifically in pharma. So I wish I could go back and tell myself not to like take it so seriously, because eventually after a month of like working here, I realized everyone at the company is so nice. They're more than willing to have a coffee chat with you and more than willing to also give you opportunity if you ask for it. You just have to take the first step and ask. One thing that I really liked about how my internship program was set up in ClinOps was they had like a spreadsheet where everyone in ClinOps would like basically drop down projects where they needed help. And there was like four of us, and we would go through the project and basically sign up for the ones we were interested in. And that really like, I guess like that one I really like, because a lot of internships you hear about like where you work on one project and that's like the only thing you work on for the 4 months. Here I wasn't working on just one project, I was working on multiple projects simultaneously. And I think that also helped me meet people.
Okay. And nearing the end of the internship, did you have a plan for what was next?
Yeah, because I knew like within the first month and a half that I knew I wanted to get experience, because I realized like getting one pharma internship wasn't going to be enough for me. I didn't mind delaying graduation if I got a really good opportunity. So I knew like at that time I really liked pharma, but I wasn't really set on it. I was like, I liked like any, like I guess like I'm very open to if it's a healthcare, health tech, biotech. So I started looking for next internships within like the first month and a half.
Yeah.
I was on LinkedIn every day. I used that as my first like job searching site, and I was actually interviewing for a health tech company. Um, it was like in a UX UI researcher type internship role, and I did like 3 interviews with them, and then I thought I didn't get the role because I didn't hear back. And that was also when I started interviewing for the next pharma company in market access. That one I actually found the role, I think in the first month of my position here at ClinOps, and I applied right away, even though I didn't have the qualifications to.
Hmm.
But sometimes you just have to be bold and take the first step. So when I was interviewing for that, literally right after my first, like the interview was done, I got an email from the health tech company that I got the job.
For the UI UX
Yeah,
designer one.
but I didn't know if I wanted to accept it because I just interviewed for this really big pharma, really, really good.
American based.
um, I won't say the name, but
Yeah.
like really good opportunity because it was a global role. And
Hmm.
I didn't know when else I would be able to work in a global role so early on in my career, especially supporting oncology products. That's like huge. You don't usually get to work with oncology products so early on, especially as an undergrad student. I was like, okay, like I know I just did the interview, but what if I just email them and let them know that I just got another offer from another company? So I did that. I emailed the hiring managers and I
Wow.
let them know that, hey, I just heard back from another company, and I just wanted to know what direction you guys were heading towards with my application, because I really do want to work here and I see myself working for you guys. And I thought like that email is gonna get ghosted because usually it's like 2 days after my interview. Obviously, they're not gonna know if they're gonna select me as a candidate because they probably have other interviews. Luckily, that email helped because my manager called me the next day and she gave me the job.
Wow. Ve- that's so bold.
I know it worked out. Like I originally wasn't gonna email them at all. I was just gonna accept like the health tech company's offer, but Luckily, my brother really pushed me to email them because sometimes you just have to be bold.
There's nothing to lose, right? So,
There's really nothing to lose. Like my mindset is like the worst that they'll say is no, and that
mhm,
doesn't harm anyone.
amazing. The global market access role, this is the one you felt that you were underqualified for, quotation
Yeah,
marks.
yeah,
So, what somehow, like,
yeah,
clearly you're qualified.
yeah,
Clearly they liked you.
yeah.
Why?
The reason why I felt underqualified was because they were looking for master's students and they were looking for, they didn't specifically say they were looking for a lot of pharma experience, but they were listed a lot of things that you need as a requirement. But I think applying early really helped my case, and having that first initial internship in ClinOps really helped a lot because that meant I already was exposed to a global pharma industry already. And then in the interview, before the interview, I actually coffee chatted a lot of people in market access in this current company, and that's how I knew I was interested in it because of these coffee chats, I even found out what market access was. Originally, I didn't know what it was. Um, and I kind of asked them a lot of questions specifically around the specific team that I was applying for in this second company. And they gave me a lot of, I guess, insider information
Oh,
that
you
I w-
coffee chatted with the team that you were.
no, I coffee chat with people here,
Okay.
but I was working for a very specific team called Pair Insights. So I coffee chatted people here because I didn't know what pair insights meant. Like I just knew market access as a department as a whole what it meant. But within market access, there's so many different streams. So I think coffee chatting people in market access at this current company helped me get a better understanding of what it actually is. Because in the interview, I could relate it, like I could bring up information that I did my research. I know what it is a little bit. Obviously, I didn't know that much about it, but I was like, yeah, I've talked to a lot of people here. This is what, like, they told me, and this is why I'm really passionate about it. Showing that curiosity and that initial interest is really important because it shows that you've done your research, you've talked to people in the industry, in the department. I also did a lot of research on the company values, bringing it up in my answers. They really love that. And I used obviously star format answers, showing that I showed a lot of leadership even in my ClinOps internship. I showed a lot of leadership at school, and they really liked that because at that company they prioritize leadership a lot because it was going to be a fully remote role. And if I didn't have like the leadership skills, that means I wouldn't be as proactive because my full team was based in America. That means I really needed to be proactive to know how to do my job.
Yeah, and I'm sure you had great communication skills that paired well with that too.
Yeah, I think like my communication skills like definitely improved throughout that internship as well. Like being in a situation where you're forced to be in office, like really pushed me to like talk to people, have those small conversations, but also coffee chats, knowing how to effectively talk to people, that helped. Um, but yeah, I think my conversation skills have definitely improved. I would consider myself an introvert, and I think I still am an introvert, but knowing when to be proactive is also really important. Stop me if I'm rambling, bro.
Hmm. I don't know, you're doing great.
Okay.
Are there any tips you'd give to people, other introverts, on
Yeah,
how to effectively talk to someone, communicate with them?
I think just like thinking of, I guess like treating it like a conversation. Okay, honestly, like for me, like thinking of it like, oh, I'm talking to a friend or a family member, like, this person is a stranger, but if you set up like the time to coffee chat them, obviously that means you're interested in them and coming prepared with questions, showing that you've done research. That kind of makes sure that you don't have awkward pauses. And then making sure you're actively listening when you talk to people, because that means you're going to have follow up questions when you actually actively listen to their answers. Um, I've always done a lot of extracurriculars in school. So in high school, I did a lot of case competitions like DECA that forced me to really,
Business.
yeah,
Yeah.
that forced me to like, talk on the spot, like improv. I did Model UN. In undergrad, I did a lot of like leadership roles for clubs and student association, and that forced me to constantly be talking to students, professors, um, different like nonprofits. Yeah, like
So a big tip is just
just
get out there.
yeah,
Take that
putting
step forward.
literally like pushing yourself out of your comfort zone because when you're young, don't be scared to be uncomfortable. Like take the first step, push yourself out of your comfort zone because there's endless possibilities for you out there. You just
Yeah,
have to take the first step.
amazing. Can you tell me a little bit more about market access? Because I know at least until I started my master's program,
Yeah,
I had no clue this was a role that even existed.
yeah, yeah, yeah,
And I'm sure most people watching this video might
yeah,
not even know. So could
yeah,
you
yeah.
describe it?
Yeah. Okay, let me try to kind of summarize.
Yeah, without
Um,
telling any confidential information in
yeah,
the
yeah,
past
of course.
companies. Yeah.
So pharma is like kind of divided in, as you know, R&D and commercial. So market access belongs to the commercial side. So R&D focuses on like the clinical trials, preclinical stage to doing like phase one, phase two, phase three studies. And then once the product is kind of ready, you know that it has a good, sorry, that has good results and it's beneficial for patients. That's when you kind of like push it towards like launch. But before you can even do that, the team market access is basically the department that ensures that your product is getting reimbursed. Because as you know, these drugs are very expensive. Without the payers, which could be public payers or private payers. In Canada, we have public payers. So our government is the one that's reimbursing majority of the product costs so that patients only have to pay a fraction of the cost. So market access department basically ensures the drug is available, accessible, and affordable. That's how I kind of think of it as.
The three
Um,
A's.
Basically. And in the US, for example, the market access department have to obviously submit these value propositions, which basically you're proving to payers why this drug should get reimbursed. You prove like all the clinical trial data and all these like obviously other like slide decks showing the benefits of the product. You submit it to public payers, which are the government bodies, and then private payers, which are like the insurance companies. Um, Other countries are also similar to the US. I think US, one thing unique about it is it's like they have so many different types of public payers and private payers. So it makes it really complicated, the healthcare system. But yeah, market access is basically a department that kind of ensures that your drug is launched into the market. If you don't get reimbursed, your drug is probably not going to be available for patients.
Hmm.
So it's like the last step almost before the drug
Which one did you
reaches
like?
patients.
Which one did you like more, market access or ClinOps?
I think for me, I don't know if this is like I'm a bit biased, but I really like market access because I felt like they were kind of like the last step before a drug is phased out into the market. Like in the R&D stage, you're kind of testing out, that the like it could have benefits, but like when it reaches like the last stage, you already know the drug has a lot of benefits. So you really push towards like getting it ready for patients and accessible for them. And like one thing that stood out to me is like market access really strives to make the drug accessible for patients. Um, I think because I worked at the second company for 16 months, I got a lot of experience in that department, which is why I liked it a little bit more than ClinOps. My experience might be different if I worked at both companies and both roles 12 months equally.
So the standard internship is 12 months, generally.
Where at?
Either company. So like, for example, the market access one, that's
Mhm.
supposed to be 12 months or it's supposed to be 16 months?
So it's supposed to be 12 months. They don't do summer internships
Right. So how'd you get to 16?
because I extended my contract. My manager really liked me, I guess. And she wanted me to stay actually another year.
Wow.
So I was supposed to actually work there for 2 years while I graduate. But for me, I realized because the role was fully remote, I didn't really get to meet my team in person. And the Canadian office, I didn't get to work with them on projects. And because I was graduating, I wanted to think about the next step in my career. Uh, so I felt like being remote kind of put me in a difficult position to network effectively with people from my team based in the US. At that company, also didn't have any rotational programs for early career. So I almost felt stuck. Even though it was a great position, it was a great experience. I was working with a great team. I got a lot of good advice. I knew that I needed to kind of push myself into a different experience. And at that position, I got to work with a lot of like implementation of like HTA databases as well as AI enabled
HTA being
health technology assessments and AI enabled tools. So that's when I started getting interested into like, ooh, what's the impact of AI and new tech on healthcare system? Because that's one thing that everyone was obsessed about and they still are obsessed with it. So I'm like getting kind of hands-on experience on a role that kind of allows me to see firsthand how AI and new tech is impacting a biotech space was like what I was trying to look for. And fortunately, I ended up seeing this position in change management, the digital technology team. And the first company I worked at, I decided to apply. Didn't know if I was going to get it, but here I am. I had to do like a case study during the interview. It was like the longest interview I had, but I made sure I was prepared and I ended up getting it. And now here
Wow.
I am.
Full circle.
Basically a full circle moment. It did feel really like I felt terrible about telling my manager that, hey, like I can't stay for an extra year. I actually got another position, but she was really happy for me, especially because she knew that it was important for my career path and kind of like the next step.
It's amazing. Yeah,
Yeah.
it's the manager almost kind of like a family. Treated you like. Tell me more about the application process for change management.
Yeah, so for me, honestly, this might be a little toxic, but I'm like, I use LinkedIn as a social media app almost. I'm there like every morning, every night,
Corporate doom scrolling, right? Yeah.
basically. I did that because I wanted to get an understanding of like what type of like positions are there in the healthcare slash biotech industry because I wanted to get a better understanding of like what are some positions I would like for myself in the future. And I would look at like the requirements so that I'm like, oh, okay, if this is a role that I really want in the future, let me get all these experiences that's mentioned in the requirements. That's why I kind of did that every morning, every night. Please don't be so extreme because it does get to your mental health. Um, but I was like applying to positions. I ended up seeing the change management role almost instantly when it got posted. And I applied, got an interview, and then before the interview, they already told me that there was going to be a not case comp, case study as part of the interview. And because I'd like had somewhat of an understanding of what change management was, I like basically used obviously AI tools to kind of get me a better understanding of what type of questions they could ask me. And then based on that, I kind of practiced my answers, tied it, like brought up my relevant experiences, and then yeah, and that helped me a lot. They During the interview, they asked situational questions in the beginning, and then the last 30 minutes was a case study where they gave me a situation that they were trying to solve with like different stakeholders, like et cetera, et cetera. And then they had like I think 5 to like 7 questions that I had to like basically answer. Um, I tried my best not to answer them and like, oh, this is the question that's asked, let me answer that. I tried to kind of almost like paint a story
Oh, okay.
so that they stay engaged and they're not getting bored because there was a lot of questions I had to answer at once.
Interesting. So you try to answer them like holistically. Okay,
Yeah.
nice. You were talking about how in your LinkedIn doom scrolling
Yeah.
that you try to look at different skills that each role required. For change management, what were the technical and soft skills that provided as an asset for this
hmm
role?
I think for soft skills, definitely communication skills is really important because as a change management specialist, almost you're communicating with so many different types of users or stakeholders in this case, and making sure that you're effectively communicating and kind of convincing them to use this new system versus like the old one. So that's really important. Leadership skills, being proactive. In terms of technical skills, I think for me, what I brought up was like my experiences where I led like pilot studies with like when I was implementing the various HTA databases as well as the AI enabled tools, kind of bringing those experiences because it was very relevant to this role. Funnily enough, the case study question that they gave me was about like an implementation of a project management tool at this company for 70,000 users. They were having some resistance with stakeholders not wanting to basically implement it. During my first ClinOps internship, I actually was doing a pilot study for that same project management tool where I was helping the ClinOps team implement it.
Yeah.
So I think that helped a lot.
Wow.
Um, so yeah, like bringing those relevant experiences and tying it to this role, I think helps. I feel like in terms of technical skills, like the role is not super technical. Obviously, like short, like let I guess you have to bring up experiences where like communicate a complex information in a way that's easy to understand for everyone. That's really important because in a change management role, you're taking basically technical information and communicating in a way that non-technical people can understand it.
Interesting. So it's less about what technologies you know how to do and more of
Can,
How do you communicate the abilities of
yeah,
the technology
yeah,
to
yeah,
other
yeah.
people? Okay.
And can you learn fast? Because
Can you learn fast? All right.
that was also one thing I had to kind of like bring up when I was answering my questions.
Interesting. Okay. And how does change management tie into the company now? Like, what's your day to day? What exactly are you doing here?
Yeah, well, I guess I haven't gotten like that much projects yet because I just onboarded. I started like beginning of this month, and like in a regular pharma company, the first 2 weeks you're spending your time basically doing all the mandatory trainings. They're endless. But one thing I communicated to my supervisor, we had like a coffee chat before I even started. I kind of let him know that I wanted to kind of start shadowing within the first week, within the first day. Like, let me shadow your meetings, let me meet everyone else. Like, I didn't want to just be stuck doing trainings for 2 weeks. I wanted to use my time effectively and learning how the different systems work, learning about different resources that I could use to kind of get onboarded even faster. So I was like letting him know, like, don't be afraid to give me projects from like the second week. And he kind of did that. Like within the second week, I had my first project. I worked through it pretty fast because I was so used to working. Like I guess during this last 16 months, I was almost working like a full-time employee because I was the only person supporting my manager for like all the market research projects that we did for the global market access team. So my role was very fast paced. So I was working with different stakeholders. I was working kind of like almost overtime sometimes. So like coming from that, like I didn't want to kind of just not have things to do. Like I like being busy. I guess you can call it a little bit toxic, but I wanted to work on different projects and get as much exposure. And he basically onboarded me onto different projects, different systems. I'm going to be working on a pilot study for a new AI tool that we're going to implement soon.
Wow.
So that's very cool because we're launching it to like so many users because this company has so many employees, over
So I get to use
70,000.
it, right?
Hopefully, fingers crossed, if the pilot study goes well.
Yeah.
But yeah, like I feel like with AI, like there's so many new tools coming out. So getting that hands-on experience is like I find it really cool.
All right. Yeah, I mean, like you said, like you were clearly you're being very proactive just from the beginning of your internship as
Yeah,
well, right?
I think like an internship is an experience for students to get the experience, but also making sure you're proactive with your manager and letting them know that you want to work on different types of projects. So if there's a thing that you like talk to those people who are doing those projects that you are interested in and ask them if there's anything you could help out with. Because that's what I've been doing. I knew that even outside of work, I wanted to be involved in the extracurriculars that the company offered. So I've made it very clear. My supervisor directed me to people to connect with, and I've told them, and I'm going to be volunteering and like helping with the marketing stuff for a couple of these extracurriculars. And hopefully, I want to work on a project, like a long-term project for a different department outside of digital technology as well.
Awesome. Yeah, I like that you're still stepping your foot out, even though
Yeah, yeah, yeah.
you're in somewhat stable-ish area.
Yeah, I think because like I'm so early on in my career, I want to get as much exposure and as much experience. And I think an internship is like the best way you can do that because you're not kind of stuck to your one responsibility. Like, like in a full time role, you're kind of given a bunch of tasks that you are like, it's mandatory for you to complete. Obviously, in an internship, you have that mandatory project that you have to complete, but you do have a little bit more capacity to do projects outside of your department. So that's when I was like, I'm gonna try to make the best out of it and get as much exposure in different areas that I can get experience in during the 8 months I'm here.
Amazing. And you've had a lot of exposure so far. You've got this is your third pharma internship role.
I will say, yeah, I've got to work with so many different departments. Like in my last um, internship at the American based company, I not only worked with market access teams, I worked a lot with different commercial teams, medical affairs teams, because anytime they needed to do a market research study, they would come to me and my manager. So I got to like know about so many different types of products that are very early on. Um, so like they were like very early on in their research and got to also listen in on some interviews with payers as well. So learning about like how they think when they're thinking about reimbursement. Um, yeah, like that was a really good exposure because I got to work with so many different global departments.
So are you still leaning towards maybe pursuing market access for your after graduation career, or?
I
What's
think
the next plan?
I think market access is a career where you need higher education for sure. For now, like I think I'm pretty set on the biotech industry, but I'm very open to what opportunities, like different opportunities, if they come up. Like I don't mind if it's in R&D. I don't mind if it's in commercial. Um, because I think you can always pivot.
Hmm.
Like it's not like I've been in this role for 10 years and I can't change anymore, right? Um, People might not agree with me, but because I'm so early on in my career, like I think I'm still unsure of like which specific area I want to focus on. I know I want to work in the biotech space because ultimately you're working towards innovations that help patients. That I'm pretty set on. In terms of like which specific job and department I want, I'm not too sure.
You're flexible. You're open
Yeah,
to
I'm pretty
anything.
open to it. Um, I did apply for a master's program in health informatics and analytics because I think that will be very important. Having that technical skills is going to be really important with like with the new tech and AI coming in. Like I don't want like and be in a position where I don't have the technical skills, especially because I don't want to be in a vulnerable situation where I'm losing my job because I don't have those technical skills. So I just want to better prepare.
Okay, interesting. Yeah, can you explain health informatics a little bit? I think that's something that's not very talked about, at least early on in undergrad.
Honestly, health informatics, I'm like still not sure what the program is,
Yeah.
but in I think it's like working with data and better understanding like the systems that holds like all the health data and clinical like very relevant for data analysis. Um, so I just like because like for me, I didn't take any technical courses in undergrad. I thought this would be a good program to kind of get that technical skills, learning how to code, learning how to understand data. That will better help me, understand like how the drug is effective. Because again, you know the drug is effective based on like for example hazard ratio, overall survival rates, like stuff like that. So knowing like how to better read the data and understand it, I feel like this program will help me.
Right. From my experience, yeah, like it's very statistical analysis
Yeah,
oriented. Okay.
yeah,
And since you already got a lot of the soft skills from your
yeah,
previous
yeah, yeah,
experiences, both extracurriculars and job related, sounds like you want to brush up on a bit more technical
yeah, just so
analysis
I'm better
wise.
prepared.
Amazing.
But we'll find out.
Yeah, perfect. Just to wrap up, thank you so much for joining me today. I'm going to ask you a post interview question. What is or two pieces of advice you'd
Yeah.
want to give your first year high school self?
um First year or high school self?
Either or, as you're starting in.
I think I wish my first year self wasn't so set on med school because when I think of life science, I only think of like you could only go to med school or go like that healthcare practitioner route. But there's so many other careers that you could go into with a life science degree. It's just you don't talk about it's not talked about enough. So I wish my first year self networked early on, starting first year, and started using LinkedIn from first year because that's a great resource to connect with people and find out about the different industries and join all these clubs, do leadership positions, join mentorship programs early on because that really helps you connect with people from different industry and find resources that you wouldn't find otherwise.
Amazing. Yeah. That's all I have. Thank you so much for joining me today. And yeah, guys, that is the second episode of Off Label Careers. And I will see you guys next week. This is Abdur Kanuri signing off.